Thank you, everyone, for being here to join us this evening for this conversation. I have to read the official words here. As a result of the executive order issued by Governor Pritzker suspending in-person attendance requirements for public meetings, Human Service Committee members and city staff will be participating in this meeting remotely. So could someone please make a motion to suspend the rules to allow us to conduct our meeting remotely using Zoom software?
I move that we suspend the rules.
A second.
Okay, all in favor, please say aye.
Aye.
Aye. All right. Oops, or do we have to do a roll call?
I believe we do.
That's correct.
Okay.
Okay. Alderman Fisk?
Aye.
Alderman Braithwaite? Is he on?
He's not here yet.
Okay. Alderman Revvy?
Aye.
Alderman Fleming?
Aye.
Okay, great. So our first order of business is public comment, and we have 3 speakers for this evening. Mike Vasilko, you're first.
Can you hear me?
More or less, yeah. Speak up.
Okay, so first, the agenda that was attached to the website for this meeting doesn't have anything really specific to a discussion about what some people call defunding the police, and yet in a news report, I read that that's what you're going to be talking about tonight. So how is anybody supposed to know that that's the agenda when the only thing attached was a very brief memo from the Director of Health and Human Services, which has no backup to it as far as what was received from different community partners. So it really is, there's a lot to be desired when it came to the attachment that was published on the website. Second of all, I still don't understand, and I've asked every time I've had the opportunity to speak, even at the second ward meeting just last week, I see no documentation that suggests there's a reason to so-called, defund police. Everybody wants to jump on the same bandwagon when other communities are doing this in places where it should be done, but we don't need to do it in Evanston. So I'm still very skeptical as to why we're doing it at all. The money that we should save from other budget items could be spent towards the good causes that people want to see funded, but we don't have to remove the funds from the police department to do that. And I guess lastly, because I don't have anything else to react to from what I received on the website, I guess I just want to know if there's anybody from the Evanston Police Department that was invited to participate in this call today.
Okay. Thank you, Mike. And then next we have Sean.
Hello.
Oh, hi, Sean. Welcome.
Good evening, older people, and thank you for your time. I'll try to get all of this in. And Mike, I hope this helps. Thank you for continuing to discuss ways in which we can reallocate funds to the community. I especially want to thank older people Fleming and Simmons in their effort to move this forward in a positive and productive direction. I hope by the end of today, you will have committed to a resolution to defund the police and have been making productive progress towards how you will invest in supporting our community growth. But first, dear Alderman Braithwaite, today during the Q&A with the mayor, you mentioned that it is so important that we talk about policing. And if we're compared to what is going on in the national scene, that we just slow down a little bit and talk about all the ancillary services we provide. You also said that there was a North Carolina study done sometime during the mayoral campaign that put the city of Evanston in the national news, which, as you said, in terms of number of stops, when you look at our number, of population and the number of Black residents, it was pretty high, and the numbers were alarming. And that apparently, this was one of the first issues that Mayor Haggerty tackled. So let's compare that today. According to that study, which was released in 2017, a Black driver was 7 times more likely to be searched than a white driver. According to the recently released EPD Annual Report 2019, they are now 4 times more likely to be searched than a white driver, with white drivers having a similar hit percentage of contraband, but 7 times more likely to have a dog searched on, with less contraband found than their white counterparts. You asked a great question. How many of these traffic stops are turning into arrests? According to the Illinois Department of Transportation, which EPD is required to report all of their traffic and pedestrian stops to, in 2016, Black residents who made up 18% of our population made up 70% of pedestrian stops. Of those stops, only 11% ended in arrest, less than the arrests of white pedestrians who were stopped. In 2019, according to the same department, EPD reported that the stop rate of Black pedestrians, now only 17% of our population, increased to over 78% of all stops. These same Black residents were arrested 49% of the time, while white residents who were stopped were arrested 90% of their stops. So what about the arrests from traffic stops? IDOT does not publicly report arrests from traffic stops. So all we have to go off of is EPD's dashboard, which is messy. This includes, they include more pedestrian stop data than they are required to share by law with IDOT, but somehow less traffic stop data. But according to their dashboard, in 2019, Black drivers were arrested from traffic stops at about the same rate as white drivers, about 17% of the time, even though they make up a large majority of the traffic stops EPD has on their dashboard, about 70%. I'll let you come to your own conclusions, but I highly recommend that you look at Illinois Department of Transportation's data on Evanston. Things have not gotten better, they have gotten worse. For the past century, we have been told that there are problems with our policing, and we have tried to reform the police department rather than focused reinvestment in building communities. I invite you to read everything you can about the Kerner report. Today, the mayor said he'd never heard of it, but it used to be required reading for the police for years. We do not need an overbloated police force. We need investment in the community we together have disenfranchised. Let us take these misspent resources and put it into a community that has been historically disenfranchised, not just in the country, but here in Evanston. What happened to the school for the 5th Ward? Why are we not making more progress for putting a STEM school in that place? Why does affluent Central Street have a personal library branch, but the 5th Ward does not? Why have we been investing in programs that benefit more affluent wards, but not listen to the voices shouting for more city and community investment in the less affluent ones? Audrey Thompson began serving as community service manager after Kevin Brown was fired in another fiasco the mayor orchestrated against a Black man working for the city. For anyone unaware, he was fired for using a city credit card for paying for parking tickets in on city vehicles, something that other city employees had long made a practice of doing. One of his complaints when he contested the decision was that he spoke out against the unequal treatment of city staff and unequal budget for the youth and young adult division. Audrey, thank you for your work if you're here, and I hope you continue to fight for providing resources for our youth. Audrey this morning was calling for the creation of more opportunities and a greater diversity of opportunities for our youth. She reiterated that when the opportunities abound for young people, you decrease crime and violence. We need more of this. Thank you.
Thank you. And then our third speaker is Doreen Price. If she's here.
Yes.
Oh, there we go.
Yes.
Yep, go ahead.
Sorry. Okay. I had 2 questions. Let me read what I wrote. I started off with my public comment just being 2 questions. And so the 2 responses I wrote answer each of those. My first question or my first observation was increased funding of health and human services for community health and well-being beyond bookkeeping transfers is something to pay attention to. And then the second issue or question was have a plan for sustainable community growth and resiliency, which is pretty much a shorthand for all the things that have been talked to prior to my public comment here, which I fully support. In terms of how we do the monies, the first question applies to Health and Human Services. And I said through partnerships, we have survived emergencies like COVID-19 with determination on the fly. But when current crises are too awful, and I'm thinking awful as in police shots awful, to bear yet, again, so much more is needed. So how do we restore and maintain well-being to prevent the next crisis? The best option, knowing change takes time. What if Evanston 2008 Public Health Clinic was still active and engaged? Could unaccepted disparities in health outcomes and longevity have been addressed via enhanced access and outreach? Have we done this in 2008? Okay. What if Health and Human Services Homelessness Prevention Fund had intervened to preserve more of Evanston's 1 to 4 unit houses, sustainably built affordable family homes, and more importantly, vulnerable longtime residents and families throughout Evanston instead of losing them? Could community well-being, resiliency, and affordability via diversity and wealth building effectively counter homelessness, gentrification, impossible new housing costs, social, economic, and family devastation post-2008, and now with COVID-19? Why not lead, fund now, and staff with local jobs, Health and Human Services, the outstanding community asset it is and needs to be? Why not Evanston? And then the second one is very short. Mayors are signing on, and this is courtesy of Bill Smith. Mayors are signing on to increasing human services, as Bill Smith reported at Evanston Now regarding today's human services meeting. Why shouldn't Evanston and Mayor Haggerty? Is defunding any agency obligatory regarding increased funding of Evanston's Health and Human Services? Bookkeeping won't correct the systemic problems. Community policing can't succeed unless city enforcement of code via police powers complies with police policy and standards, including accountability and oversight, or redirect all the city enforcement to either the Health and Human Services or EPD with burdened regional agencies. And I'm not saying that we don't have outstanding help. It's just not enough. What Evanston's Health and Human Services Department vision and timeline to protect and invest in our diverse and unique residents currently at risk now for sustainable resiliency in the future? One heart, Doreen Revvy.
Okay, thank you. Now we're going to turn to our main item of discussion for this our meeting this evening, and I'm feeling remiss that I didn't read Bill Smith's article about what we're going to talk about, because I don't think it's quite true. But so tonight we're going to be having a continuation of the discussion that we began earlier this month, which is to look at the programs and resources that the city currently has available and uses to respond to our 911 calls for service. I think it seemed to a number of us, when we looked at the compilation of 911 calls that the police department provided to us, it suggested that there are really a good number of the calls that are made to the police department that don't necessarily require the response from a uniformed police officer. And so the question is, would an alternative public health emergency response model that sends, for example, a 2-person team with perhaps a mental health professional and a medic, with that kind of a team provide a better outcome for our residents who are experiencing some kind of an emergency crisis situation? So at our previous meeting, we heard primarily from city resources that go into responding to these emergency calls. And what we want to do tonight is hear more from our nonprofit community about ways in which they are either already providing emergency response services, or could, if we turn to them or just have a conversation with them about what they think would be the best way for us to be providing for our residents who find themselves in these crisis situations. So we're interested in hearing what role your organization plays in assisting individuals in crises, Do you respond actually to emergency calls, or do you provide services, let's say the next day, during office hours, as it were? And then what do you see as the short-term and the long-term outcomes for the ways we're responding to our residents who are finding themselves in these crisis situations? So we have a good number of people here with us this evening, and we really appreciate your joining us for this discussion. And I'm just going to sort of start on the list here. So we have Ariel Jackson, we have from our Victim Services Program. Is that correct, or not yet? Or we could hear from Kristen White from the YWCA.
Good evening, I'm here.
Oh, okay, thank you. So Ariel, could you tell us just a little bit about your role in responding to these crisis situations?
Absolutely. Good evening, Madam Chair and members of the council. I am one of two advocates, victim advocates who work in the police department with the city in victim services. We provide 24 hours, 7 day a week, 24 hours, 7 day a week crisis response, in-person crisis response. We also, that coverage covers after hours. So we currently work a 1 week on, 1 week off after hour crisis response. So what that means is when there's a crisis that comes into the station, that comes into the police department, and victims are impacted, depending on what the crisis is, they are given an option. If they want us to respond, the victim will say, I can talk to them tomorrow, or yes, I need an advocate now. And then there's some situations where there's not an option given. For example, certain calls, homicide calls, there's an automatic call where victim advocates come out to the scene in person to provide crisis intervention and support. We are a 40-plus-year-old department. Evanston was one of the first in the country to have a victim services within their police department. Our department was the model for the Cook County State's Attorney's Victim Services Department and many other departments throughout the year. We regularly consult with other police departments around the country on their victim advocacy programs. So we also do court advocacy. So once a case is charged and goes to court, we go to court with and many times in place of the victim. Court dates travel on. Many cases can go on for many years. That's very difficult for a victim to have to take all of that time off, or even if a victim has relocated, to have to keep coming back and forth. And so we will work with them and go to court in their place. We work with Illinois Crime Victim Compensation to assist them in recouping funds for any loss of wages or property, in some cases, as a result of being a victim of a crime. We work with the Children's Advocacy Center with crimes against children. So our services are comprehensive. We respond to every police report that is made where there is a victim or a potential victim listed on the report. So the police reports are added to the system, and then the next morning they're uploaded for my partner Kelly Nelson and I to view, and we go through every single report every single day and make phone calls to those victims, whether they wanted follow-up or not, just to ensure that they're getting the services needed, that they are in touch with the right officer, they're in touch with the right detective, they understand the process, or to be certain that they don't want to move forward or that their needs have been met at that moment. We work with the DCFS, the State's Attorney's Office, the Medical Examiner's Office, the Fire Department, obviously the court system, other police departments, other police social workers, and any other stakeholders to ensure that our KPIs, our key performance indicators, are being met on a daily basis. So I don't know if you have any questions.
Alderman Fisk.
Thanks, Ariel. Can you talk a little bit about what your training is? Just let us know what continuing education you might be doing within the department.
Absolutely. Kelly and I are both master's level social workers. Kelly, I believe, has 12 years of social work service, and I am in my 20th year in social services. I am also at the beginning of my victim advocacy credential certification training. So there's an actual certificate program for victim advocates, and I've begun that program this summer. Well, this fall.
Great. Yeah, Alderman Fleming.
Yeah, thank you, Kelly. So as you know, we're discussing, alternative responses to 911 calls, and that was a great presentation you gave. My question, however, is when someone calls 911, you are not going out with the police or without the police, just an immediate response to that call. Is that correct?
Depending on the call, when the 911 call comes into the station, depending on what it is, we will go with them. In some cases, we never go before them.
Okay. And you never go without them?
We never go without them.
Okay.
That's correct.
And who makes that determination whether or not you should go or not?
Our immediate supervisor, Indira Perkins, or Ike, the director, and if they're not available, then Deputy Chief DC Barnes or the Chief Cook will make a determination that we're needed at the scene.
Okay, so if there's it's hypothetical, so we understand this. So if there's a 911 call, then 911 dispatcher obviously sends out a police officer. If the dispatcher thinks that maybe this is something for you all, then they will call your direct supervisor, who will then decide if you all should go out.
No. So there's a 911 call that comes in. The officer and the supervisor go to the scene. The supervisor assesses that their victim services is needed. Supervisor calls dispatch. Dispatch then calls our supervisor staff, Indira or Ike. If they're not available, then the call then defaults to Deputy Chief, whoever the Deputy Chief on call is, or the Chief.
Okay, and then just understanding that you all rotate shifts and you do, cover 24 hours. If you're not, at your office in Evanston here and you're at home or, living your life on the weekend, about how much time does it usually take you all, or what is the window of time that you all try to be available to get to a call?
We've always operated within an hour response time. That's an hour from the time we're notified. So if there's a gap in services between the time, let's say Indira gets the call or gets the call and then reaches me, that my clock starts once Indira reaches me. So it's realistically, the most is like an hour and 15 minutes door to door.
Okay, so I asked that just, as we're having this very public discussion, it's important for me to keep my mind and citizens thinking about alternatives to 911 calls. And so I think your service, regardless of what we decide to do, at the end of this conversation, your service is very vital, and I appreciate the work you all put in. Just with the conversation with my peers, I still see this as something that we should keep going. I don't, for me, see this as something that fits into an alternative response to 911. It's very, very valuable service, but they're not kind of serving the need of which we identified might be out there.
Yeah, Alderman Fisk.
Yeah, Ariel, I'm interested in how do you know? Do we have Ike on the? Is Ike here with us? I'm wondering.
Yeah.
Okay, I'm wondering what happens when you're notified that victim services or victim advocates are being called for. What do you and Indira do? I mean, is that a step that's needed, or is that something that we could a step that we could take out to get a slightly quicker response. Could you just fill us in on that?
So usually, good day everyone, this is Ike Ogbo, Director, Health and Human Services Department. The reason that we put that step into place is for us to be aware of the situation at hand, so that the police can get in touch with us and let us know what the situation is at hand, so that we can have that information in our fingertips. That is the step that we put in place to ensure that.
I guess I'm not understanding. I mean, what do you do with the information? I mean, would you call out, I don't know, can you just give us an example of how that would work?
Yeah, absolutely. So let's say there is a battered woman, for example. The police officer reaches out to us to call an advocate. And the police officer reaches out to us for us to have this information so that we can take a look at the case, do an assessment of the case, then call out a victim advocate to respond to it.
What do we do when we assess the case? I guess that's,
So,
I'm wondering why the case can't be assessed right there when it's called in.
So when it's called in, and this is actually in order for us to follow the process that we put in place, and not to say that it cannot be improved as we go along, but this is a process that we put in place so that we can be informed and enlightened about that particular case. And it doesn't take much time, so to speak, when an officer calls us and us making a contact with the victim advocate. And it might also be a situation whereby the officer is trying to determine whether an advocate is needed or if it's something that an advocate can respond to the following day. Then we can put our heads together, or we'll make a determination and say, okay, well, looking at this case, it doesn't seem like it is severe enough to have an advocate respond right away. This can be something that an advocate can respond to the following day. So we just put that step in place just to ensure that we are enlightened, that we are informed of these particular cases before that's being transferred to an advocate to respond.
Okay, well, I would just, for the committee, I guess I would like to look at this a little bit more detail.
May I also say one of the more vital things that has happened in that step is that because we work, we've been working remotely, but in a normal situation, we work in the station. So we physically work separate from my immediate supervisor and the director. And so sometimes it may be difficult, things happen really quickly. It may be difficult to keep them in the loop as things are happening. It's harder for them to keep their pulse on what's going on. For me, I can say, like I said earlier, Kelly and I alternate weeks. So there was one week when we had 3 horrific things happen. That was my week. So we had 3 very horrific things happen, and then lots of other things happened throughout that week as well. And so because Indira was getting those calls back to back, she was able to say, hey, she kept in touch with me to see if she needed to come out to kind of help and assist, and also keep her pulse on what sort of self-care was needed. Because Kelly and I have done this for so long, sometimes we don't recognize when we're operating in autopilot. With just being 2 advocates. And so having the calls kind of filters through them, keeps them in the loop, and then 2, keeps them up to date on where we are in our cases. Because it's just 2 of us, if one gets overloaded, that kind of throws the entire department into a tizzy. Mm-hmm. That's just from my point of view.
Okay, that's helpful.
Good afternoon, Committee.
Is Ariel, do you ever
Yes,
think you need one more? Do you ever think you need one more person? I mean, is that helpful? Would that be helpful? Or I'm
Absolutely.
trying to get a sense, as we go through our discussions, I'm just trying to get a sense of how staffing would change and what we need.
Absolutely. I think staffing would help. In the course of 5 years, we've gone from 4 advocates to 2. And so staffing is an issue. We've made the best of it, but to be very transparent, it becomes difficult at times. I am thankful that we have an incredible team with great leadership who help us to kind of compartmentalize and care for ourselves as well. But yes, we would benefit from additional full-time staffing.
Okay, thank you.
Mhm.
Alderman Fisk, if I may jump in, this is Indira Perkins, the
Mhm.
manager of Victim Services. So as Ariel was saying, Ike and myself, and it's usually me, Ike is my backup, but I like to get those first because I also like to know what the advocates are walking into. And somebody is messaging me. I also do feel that their self-care is important.
Right.
All of the recent homicides that we've had in the last couple of weeks, Ariel had every single one of those cases. And so sometimes if I have a call coming in and I know Kelly may be available, I'd rather call her and not Ariel because I think somebody with a clear head needs to go in instead of the advocate that may be on call. So that's another reason why Ike and myself like to be the middle person before we send an advocate.
Okay, well, that's good. It's good to have an explanation, but I just want to make sure, again, committee, that we're plugging in the conversation about adding an additional person to victim services, victim advocate.
Yep, right. Yep, thank you. Okay. Well, that was very impressive amount of work that our victim advocates take care of for us. That's really, really impressive. Kristen White, can we hear from you from the YWCA and what kinds of emergency services you provide as well to people in crisis?
Sure. Thank you for inviting us to join the conversation. I'm the Chief Operating Officer at YWCA, so I oversee all of our programs, including our comprehensive domestic violence program, which is the only one serving northeastern Cook County. And what that means by comprehensive is that we do everything that's we do extensive prevention work with youth, as well as intervention and emergency and response work. And that includes our 24-hour crisis line that provides crisis counseling, case management, resource referral, as well as intake for the different services we offer, emergency shelter, long-term housing, as well as transitional housing, which we deliver in partnership with Connections for the Homeless. Additionally, we have counseling for residents as well as community members at no cost. We service a number of residents in Evanston who are still choosing to reside with their abusers. And much of our work with them is helping them understand the dynamics of domestic violence, as well as how to safety plan and safely escape when they decide they're ready for that, as well as legal advocacy at the Skokie Courthouse in helping individuals get emergency orders of protection, as well as plenary orders, which are those that come after the emergency order. Our staff have specialized training. Most of them are MSWs. They have 40 hours of training in domestic violence, and some of them as well in sexual assault. And most of our crisis work is done through our phone line. That is both dealing with people in immediate danger and those who may not be in immediate danger, but are intermittently in danger and are seeking to exit from that situation. We don't go out doing street intervention work. There are models for that around the country. We did work briefly with the city for 6 months at their request, providing victim services for domestic violence victims in Evanston. And ultimately that was not a fit for the way that we work as an organization. And I think as you look at ways to think more creatively about meeting the needs without relying on police, I would encourage you to, it's not as simple as just giving money to a nonprofit organization and asking them to fill that gap. There's a lot of complexity to the integration of systems, whether it's information sharing, confidentiality, the building of trust between staff who might have been used to doing work that now is not something on their plate, and what comes up with that. So though the conversation is critical, the solutions are far more complicated in terms of operationalizing them. So if this committee chooses to move in that direction, I encourage you to have conversations with organizations who have worked with the city in these ways to understand some of the systemic challenges that make it difficult. They're not insurmountable, but there are both expected as well as unexpected challenges when you're merging institutions and different cultures and ways of working, and even ways of coming at the work, whether it's from a police lens or a social service lens. There are also opportunities, I think, for Evanston to think about preventative work, not just emergency response. So there are fantastic models around the country for high-risk response teams where the police, in partnership with community organizations and school districts, are identifying those families who are most vulnerable and rallying the resources in advance of crisis where the police would need to be called in. We've had efforts in the past to implement that in Evanston. I think there's still an opportunity to look at all the partners who could play a preventative role in meeting families where they are before crisis happens. So we offer a lot of other services, but in terms of crisis response, that primarily and really exclusively occurs through our domestic violence program.
Right, thank you. Committee members, any questions? Yep, Alderman Fisk.
Do we know who those potential partners are? Was that something you could?
Well, I think it's really looking broadly at what are the human needs of our families and our community. And it's around mental health, access to physical and medical health, it's domestic violence, it's substance abuse, it's housing access, all of those pain points where families get stuck and their lives get blown up because they lose a job or they get 1 month behind on rent. And those escalate into additional crises. And so it's not rocket science in that we know when you're poor and you have all these systemic barriers, things are much more complicated and difficult to navigate. And so I think there are a lot of organizations in Evanston that can bring resources to bear before those families reach crisis, if there is a collective coordinated way of sharing that information and there are systems in place to facilitate that.
Okay, great. Alderman Fleming, any questions from you? Nope. Right. Okay, well, I have a feeling we may be coming back to you, Kristen, for more input on this. This was very helpful. Thank you.
Alderman Revvy, before we go on,
Sure.
I forgot one question I had for victim services. Can we go back real quick before?
Sure, of course.
If Ariel's still there. Ariel,
I'm here.
Can you just very briefly, I know you talked about going out and working with the victims, but do you all do any work with perpetrators of violence? And then, there's only two of you, so I realize that. And then kind of what happens when you go, and I imagine, your services are optional. And so if we have people who either don't want to engage with the police department because of trust, or at the time of the crisis, they are not ready to engage with you all, kind of what happens with them?
So our work with perpetrators is unique in that there are two of us. And so in a lot of domestic related issues, you can be the victim in one situation and the offender in the other. And so our rule of thumb is kind of, once I've worked with you as a victim, I'll always work with you as a victim. So then so if Kelly had someone as an offender in her case and they are now the victim, then I would take that case and work with them in the role of the victim. In terms of straight victim and offender, beyond referrals for additional services that they may call us to ask for, we don't do a lot of work with them, just for confidentiality issues and for the safety of the victim. It would be difficult for us to work with the victim and knowing the offenders continually calling us to give us their side of the story. So we try to keep those lines pretty clear, those boundaries pretty firm. And so we may give referrals for services, but we don't necessarily work with offender services. I believe there was,
If there was a victim and perpetrator, but maybe the victim doesn't want your services, would you still then not work with the perpetrator?
If the victim
So if
did
you
not
look
want
at
our,
domestic violence and the victim does not want our services, but maybe the perpetrator is interested, would you still, because there's no conflict, would you potentially work with the perpetrator there if there's no victim who's interested? Or you
in domestic,
focus on the victim?
as it relates to domestic violence, no, we would refer, we typically refer to the offender program that the Y has. We don't, so first of all, Kelly and I don't do long-term counseling services. We're qualified to, but because of the nature of the job, we can't supply continuity of care for long-term counseling services. So we don't do individual sessions, family sessions, groups, things of that nature, simply because with crisis work, we'll never know when we're going to be called away. So if an offender wanted some help, we wouldn't say no, we don't work with offenders and hang up. What we would do is make sure that we connect them with the services that do provide help for offenders.
Okay.
So we would do information and referral.
Okay.
I'm sorry?
If we have a victim who either does not trust or want to engage with the police department or isn't, interested in your services at the time of engagement, then what happens?
So many times we go to a scene, it's volatile. If there's information that I need to give the victim, there's some things that are going to always come up in certain crimes, in certain victimizations. So if there's information about the medical examiner's office, what are the next steps beyond this moment? The victim may not be ready to receive it. I will ask the victim, hey, is there someone who's speaking for the family? Is there someone I can give this information to? Or B, I will follow up. I will continue to follow up. Hey, I know that you didn't want to talk. I just want to check in with you. I'll be in touch with you in the next couple of days, and we establish a pattern or rapport beyond that. So it's victim services support is completely driven by what the victim wants. And so some will say they don't want anything from us, and they will continue to not want anything from us. And some will not want anything in that moment, but then as the time goes on, will want assistance.
Thank you.
Mm-hmm. Could I share, Alderman Fleming, with our perpetrator program? Because I do think there's an opportunity for you all to consider that as well. I think that's an excellent question. We have the Illinois Department of Health and Human Services has a certified program called Partner Abuse Intervention Programs. And I imagine there are other programs for perpetrators of other types of violence as well. Ours is a 26-week program that's in Evanston. It's at sliding scale. We don't turn anyone away. And it's at this point, IDHS has only certified for male abusers. But we have partnered for a couple of years with the Department of Health and Human Services in Skokie. And we take young men who have violated municipal codes and they're referred to the program so that they don't enter the court system as a first step. And so I think there are other perpetrator programs out there. I'm not familiar with those that are not domestic violence related, but I know there are other options and creative, innovative things happening in that arena as well.
Alderman Fisk.
Kristen, could you come back for a minute? There you are. Okay, so if I heard you correctly, and Ariel, when you're in the situation where someone does not want to talk to you or the police, you can refer them on to the YW program. Is that correct? Am I hearing that correctly?
No, what I said was when we have victim and offenders, we don't have an offender program. And in those situations, when offenders want information and referral, we typically refer them to the YWCA's program in those situations. So only when offenders seek out information from us, we don't provide offender services. We don't have any counseling programs or groups or anything of that nature, but we do work with, we have worked with the Y in the past in making referrals for offenders who are seeking help to their program.
Okay.
And so
is that taken into consideration if an offender is interested in doing that? Is that taken into consideration in the police response to that offender?
I can't say what happens on every police patrol stop or police encounter. I'm not certain. I do know that once the case has escalated to court, the judge will mandate those things. So there are other avenues to be referred.
Okay.
So yeah, that's how we would respond to those sort of inquiries. We would make the referral.
Okay.
Things of that nature. Thanks.
Okay, that's helpful. Thank you.
Okay. So thank you both. Let's turn now to, we have several people here who are sort of our leading advocates on, in terms of responding to our homeless people in the community. So Betty Bogg, can we start with you, and can you share with us what Connections does in terms of sort of a crisis situation, as opposed to just coping day to day, as I know you have to do?
Sure, I'm happy to. We consider ourselves part of the crisis response system, and almost everyone we work with is in some kind of crisis because they've lost their housing or they're about to lose their housing. They're often impacted by mental health and substance use disorders that make the crisis even deeper for them. Our staff utilize evidence-based practices like trauma-informed care and harm reduction to de-escalate crises as they're occurring. That being said, it's not always possible to de-escalate every crisis, and we we're not necessarily, and we're certainly currently not resourced to do crisis response for someone who is experiencing something out kind of in the world, not in our programs. We're responding to crises in our programs all the time, but we do have a 2-person outreach team who does do street outreach, and we do our best to respond in a timely manner when we receive calls, but it is certainly not a situation where like someone's in a fight on a street corner and we can show up, and if they have a mental health issue, we do not have the capacity for that kind of emergency response. We have worked with Evanston Police Department to provide trainings in de-escalation and in understanding what it's like to work with someone who is experiencing a mental health crisis specifically. We respond, aldermen often send us folks who, refer folks to us who are in crisis, but again, that is not an immediate response. I just want to make sure people's expectations are clear. We have, I would say, expanded our response to the COVID crisis in ways that we didn't even dream possible. And so we're running this rather large hotel operation currently where, again, everyone's kind of in a crisis. That's why they're staying in a hotel as part of sheltering. And it's become much more, I have a much more visceral response to understanding what the kind of stress that Kristen has referred to when people are poor, when people have lost their jobs, when their family members are sick, maybe they're living in a really unstable housing situation. There's 4 or 5 families living in a small apartment, and the apartment owner just says, I can't do this anymore. And so then people end up in this horrible situation without any resources. So I think our perspective on how to deal with that is to, and I know this isn't directly what you're asking me, but is to prevent those crises in the first place with appropriate housing counseling, with rental assistance when it's necessary, with eviction prevention when it's necessary, so that people don't get to the point where they're out on the street with absolutely nothing. I would also say that our partners, Family Promise, Interfaith Action of Evanston, the YW, together we create a shelter system, and that system lacks capacity right now. So if we had resources to increase the number of beds available, then if the police find someone in a parking lot or sleeping in a box or something, and we had a big enough shelter system, we could take that person in. Currently, none of us have the capacity to do that, although we're trying to be strategic as we come out of this to figure out, what our options are for increasing shelter capacity, so that at least that kind of crisis is something we could be, responding to more quickly. We're also very open and would be very willing to engage in discussion about having a more responsive outreach team who could be more available. There's so many great partners on this call who do great work. And I do think there's capacity in the community, if we're adequately resourced, to expand those services.
Thank you, Betty. Questions, Alderman Fisk? Yeah.
Hi, Betty. Could you tell us a little bit about the interaction between you and the police? I know our PST officer, Willarswaga, has been called on several occasions. Can you just sort of integrate that with what sort of support that you might need, and what we might be looking for in terms of providing assistance, for example, more staff or whatever. If you're thinking about, and as we are thinking about in terms of how we address some of these, social service needs, how do we do that? How do we work with the police department and do that? What do you need on the street?
Yeah, I really appreciate you
If you're not able to do an immediate response, what do you need our officers to do or know, or how can they be better prepared?
I really appreciate you asking that, and I'm very aware. As you may see, I'm at the Orrington Hotel. This is where I've been for 3 or 4 months now, kind of during the week, and there is a definite need for police intervention from time to time here. It's generally not our staff calling the police. The participants kind of will get into it and kind of call the police on each other. Our role in that is to try to de-escalate the situation before it gets there, and sometimes we just can't get everybody calmed down. They want to activate that option for themselves. I think Chief Cook and I've had several conversations, and he's been very responsive. Sometimes, hotspots kind of move from place to place in the community. So when we notice like there's a thing on a corner, sometimes just having a cruiser parked there is a deterrent for unwanted activities. It is never our goal to bring the police into a situation, and this isn't the fault of the officers. It can just escalate it even further, and it can become very dangerous for everyone involved. I think that the key to the experiences we're all having with having so many people in this very dense area is to, we need to depopulate these hotels, and we need to move people into housing. We don't want to be Connections. We don't want to operate an SRO where everybody's there forever. Our goal is to have this be a transitional situation where someone becomes homeless. It's impossible to stop the event of homelessness from taking place, but we need a safe place for them to go. And then then we need a place for them to move to once they've stabilized. So on one end, it's like having shelter capacity and a place to put people. Certainly staffing, we're staffing 24/7, 3 different locations. It's quite expensive. But we're happy to do that work. It's what's necessary. Excuse me. But really, affordable housing on the other end is what keeps people from losing their homes in the first place. And then it's also the solution for folks who end up in this situation.
Yeah.
And we'd be happy to, like, if there's a way for us to piggyback, like if we our staff can go out with police officers, when we're going to investigate some situation where there might be a homeless person that we don't know about, we're happy to go along with that call. Right now, we don't have the capacity to react at the moment.
Well, let's invite a couple more people into this conversation about homelessness. So Susan Murphy from Interfaith, I think you're here. Maybe?
I am here.
Okay, hi Susan.
And so at Interfaith Action right now, we still have our morning center every day. It's open from 7 to 11 for anyone who is homeless to come in, have breakfast, and we will be reopening our computer room and have our employment counselor back again tomorrow. They've been off during the last few months. And we work closely with Connections. If there is a new person who comes in who is homeless, I call their outreach people right away, and either they come over and talk to them, or we make arrangements for them to go to the Dewey office of Connections. We also are still doing soup kitchens every day. There's at least one every day in Evanston. We do have to hand the meals out at the door now, but we do have plenty of meals for people. The Produce Mobile is at James Park twice a month, and they are giving food to 250 plus families. Oh, sorry, that's my clock.
I'm also a professional stuntman. Now, kids, don't try this at home.
Sorry about that. It's my cuckoo clock. And we are working on getting the overnight emergency shelter started. It'll look different than last year, because last year we were getting as many as 40 or more people each night, and we probably will not have a space large enough for them. But because many are at the hotel or getting housed, we're hoping there'll be less people. But we're working right now to get the commitment from the faith communities to continue to host.
Yeah, great. Any questions for Susan? And then also, is Monique Parsons, are you on the call? Somebody, because I know the YM is also a place we rely on for help with people for housing. Or let me move down my little list here. How about Patty Capuch from Impact Behavioral Health?
Hi there, I'm Lauren Smith. I'm on the call for Patty. I'm the clinical program manager over at Impact. So our capacity for crisis care is definitely a little bit different because we're just providing a crisis line for those that are already in our program. So mostly those that are connected to our clinical services and in our housing as well. So that's just our clinicians who are all master's level or licensed. They rotate it's like a 6-week rotation, and they all are on call for a week, and they take whatever calls come in. There's not a huge amount that come in. A lot of them are housing related, like my sink's broken, right? Or something like that. The mental health crisis calls are less, but that's what we have available. definitely are looking to partner with more local agencies, and we're starting that specifically with clinical and employment that we have as well. So definitely capacity and interest in that.
Great, thank you, Lauren. Are there any questions for Lauren? And then is somebody here from North Shore Hospital?
Yes.
Yes, okay.
I believe there's three of us. I'll go first, and I'll, if you allow, let the other two also chime in. I'm Ernie Wong. I'm the Chief of Emergency Medicine at North Shore. Start my video. Hey, how's everyone? I got to tell you, this has been an unbelievably educational session for me. We only see a slice of the spectrum of what everybody is doing, and I'm just so impressed with all the work that people do in our community to take care of people in all kinds of crises. And I've been an emergency physician for 20 plus years, and at Evanston for 20 plus years. Betsy White is the director of our social work program, and they are just an amazing group of folks. And Joan Casey is the lead ED nurse manager at Evanston, and also coordinates a tremendous amount of this care that we provide. So I think they have more expertise certainly than I, but I will say, listening, it seems that each of us has a piece of this puzzle, and we're all trying to get to the same goal. And we take patients in crisis either self-directed or from a referral or by EMS or police for evaluation. And in the emergency department, we will do first and foremost a medical screening exam to make sure there's no underlying acute medical condition. And once we have determined that an acute medical condition does not exist, or and now there's able to be evaluated from a behavioral psychiatric standpoint, then we contact our colleagues, our crisis social workers, and they come and do an evaluation, and they discuss in conjunction with their psychiatrists, the case, and try and help us make dispositions. I will say that, we have a tremendous shortage of beds as well. And that's challenging. I'm gonna let Betsy kind of talk about, those particular challenges. But from the emergency medicine standpoint, boarding of behavioral health patients is truly a national crisis, and we're seeing more and more of it in our emergency department with longer and longer lengths of stay, which not only is bad for the patients, but also bad for our staff and for other patients that need emergency care. If you have a patient in the emergency department for 2 days in a room, we can turn that bed and treat many patients over during that period of time. So it's not the best use of the emergency medicine bed. And so what I think, what I'm hearing is there's so many integrated parts that what has worked, and what I would like to just kind of put out there is there's an Alameda model based out of Oakland, and I think it's an effort worth emulating or thinking about. And it's basically they've created a psychiatric medical home in the Bay Area with funds. And I'm sorry if people know about this already, but what happened is the local city government of multiple counties came together and created a dedicated psychiatric hospital with a crisis stabilization unit. They take patients from all over the Bay Area, 60% of the time directly to the facility, bypassing emergency departments. And the EMS providers are trained to do a clearance in the field. They have taken their intake time down from 6 to 12 hours down to a couple hours, and they discharge 75% of their patients, as opposed to the 50% that currently sits nationally. And they either place them in a facility because they need psychiatric treatment, or they partner with local agencies to find shelter, find other resources. So I would love to see that type of approach be discussed, where everybody seems to have a little piece of it, but there needs to be a quarterback for this. I'm going to let Betsy and Joan talk.
Okay. Thank you.
Sure. Well, thank you. Yeah. And thanks for having us. I'm Betsy White. So I recognize some names and faces. I'm sure I've interacted with people in different capacities. So I am, in fact, yes, the manager for the crisis intervention services at North Shore for really out of the Department of Psychiatry, but embedded in the emergency room. My team also is a bit of a, I guess, centralized intake for the Department of Psychiatry in terms of our programming. So, all the mental health programs and addiction programs that exist at North Shore
They were basically going down
come
the
through
list, so
our
everyone was on the call.
Yeah. But we also have a crisis hotline that runs 24 hours. It doesn't get a ton of traffic, I wouldn't say, for whatever reason. But at any rate, we're seeing those patients in the emergency room with psychiatric crises. So one of the things that has struck me in this conversation is that we're all defining crisis a little bit differently. And of course, that's because of our work and our expertise and our specialties in our context. So I do just want to define that my version of a crisis in terms of my team is really exactly what Dr. Wong said, which is that it's psychiatric issues, right? So those patients who need to be evaluated for level of care within their psychiatric concern, and also risk for harm to themselves, others, or functioning as well. And our team struggles a lot, as was mentioned, to move patients. So that's probably the biggest issue. They're very, very skilled at what they do in terms of evaluation. They're very confident in terms of that. But I think that there are so few beds, and the COVID crisis has made that worse, because for those of you who don't know, psychiatric units are an open milieu. So, those environments are not particularly good for, a pandemic and the things that come with the need for infection control. And that would be standard regardless of the current situation. So there's a lot of delays. There's delays related to testing. There's delays related to, our unit, for example, has come down. Their census has dropped, or their cap, I guess, if you will, has dropped because of needing to have enough space to keep people safe from that infectious control perspective. It's a big challenge. I think it's one that we were already facing. And, you could look at it from any point in the continuum of the crisis for the patient. I mean, we're certainly speaking to prevention, and that's a big part of this. I think there's a lot of work to be done at all the stages. So whether that's, having de-escalation out in the community so that patients have a place, or clients have a place to go before this really gets so acute, right? Or it's helping someone move out of that crisis, a first responder, that sort of thing, so that those patients, or so people don't become patients, so they don't have to come into the emergency room. And then, of course, once they're there, there's things that would be really helpful to move things along, like, the model that was just mentioned, the stabilization and so forth. So it's multi-layered. It's there's so much that could happen, and I think being at the table is really is a good thing for us, because we're seeing maybe the other side of it. I don't know if it's the other side, but it's further down the line, for those specific kinds of crises.
Great, thank you.
I know, Joan, if you want to add.
Yeah. Is Joan here? I don't see her on my screen.
This is a first. Usually she speaks for me. So.
Yeah, she was. I saw her earlier, so I'm not sure, but maybe she got disconnected.
Let me see if my colleagues have any questions while we're. Okay. Nope. Okay. I guess I had one question, and I don't know exactly. When I think about sort of some types of emergencies that come to North Shore Hospital, those are for intoxication. And I'm thinking particularly when we have some Northwestern students who get a little carried away. And so what do you deal with substance abuse and those kinds of things as well? Every day. Every day.
And it's not just the Northwestern students. It's really a societal spectrum of issue. Rich, poor, student, everybody has a slice of that pie too. And so it makes it doubly hard, because then you're having someone who's acutely intoxicated who might be suicidal, and then you have to watch them until they are sober and then able to be evaluated. And in that time it could be anywhere between 8 and 10 hours, and after that, depending on what the situation is, they can either be okay to go, they're no longer suicidal, but they have no place to go, or they're still suicidal, but they we don't have a place to admit them to for treatment. And so that's not uncommon. We see that a lot, and just kind of as a perspective, I walk in the morning to any of our North Shore EDs, and I look and see kind of who's there. And I think Evanston carries this burden more than, say, Highland Park and Skokie and Glenbrook, but there will be sometimes half of the ED is psychiatric evaluation, fully.
Yeah, that's right. And I think that is happening partially because I can say from our perspective, volumes are highest at Evanston, and that's, I think, happening because we have a unit at Evanston. And so a lot of people are self-selecting to that emergency room, thinking that is the path of least resistance, perhaps. I'm not sure. But also, I think, Evanston is, it's a city that is complex and has, there's a child in the mix, but I think I see a dog and a cat, so I think it's okay. So I think, it's a different population of people that we're serving, which is, really wonderful. And with that diversity comes, a lot of complex mental health issues. So I do think we're busy, and there's a breadth of circumstances that people bring with them that are challenging. And but I also think that there's a lot of resources actually compared to some of our other environments. And so that's really lovely too, in terms of our work to set people up and refer people.
Right. And I will just, I will just add another comment. And this is one where I've seen over the years, and at the beginning we talked about, is there a better way to potentially intervene in the field? We see patients come in all the time with Evanston police because they're intoxicated, or it's substance abuse primarily, or it's a behavioral problem, not acutely psychiatric. And we know that they probably don't meet the requirements for admission or or don't need that, but there's no place for our police to take them in that moment. And it is I feel for them in a way that it's truly, they're in a no-win situation. And so I get everything that's going on. I think we have to obviously be sensitive to that, but I see that as a part of the, they can't win in that situation. So we have to help each other out.
Right.
Hey, you guys. Hi, I'm so sorry. This is Joan Casey. Can you guys hear me yet?
Yes. Yeah.
Yes.
We can.
I'm so sorry. I had an app I was reading out, and I apologize for wasting your time. Again, my name's Joan Casey. I'm the clinical nurse manager of the emergency department at Evanston. And it's so nice to meet with all of you. And I really appreciate what Betsy and Dr. Wong have been saying about meeting the needs of the mental health patients. And it's nice to see my advocates, Kelly and Ariel, speak with them, and people from Connection for the Homeless in the Y. The only other point I'd want to make is that a fair amount of the patients that we see, not so much in the summer, but throughout the year in the colder months, are the patients who have medical needs that they are seeking assistance with throughout the community, not just the mental health, behavioral health, but truly medical needs. And especially talking to or listening to the program about the Interfaith Council, we rely on those resources a lot. I mean, we use our medical partners at the Erie Clinic. We use people at Interfaith so that we can give people resources for shelter where they can go in the soup kitchens and the resources they have. The one issue we do run into is that many of these shelters close up or fill up by 6 o'clock or 7 o'clock at night. And when the winter months get cold, patients that come to us, if we don't discharge them by then, we really have nowhere that we can send them to. And the resource I think we're sometimes directed to is to send many of these people to the Rogers Park Police Station. And then I believe they get a bus to Pacific Gardens Mission. And for many of the people that are local, that's not, they don't see that as a resource. And I think one of the needs that we see is if there would be more of a place where we can help people, and I know Connections does a lot for them, but we could help them with their acute needs and have these type of advocates that they do have within the mental health world just for their social services needs too.
Yeah. Okay. Thank you.
Thank you.
Committee questions? Well, while we were on the subject of substance abuse, I know we have, I think maybe Maureen McDonald here from Peer Services. Maureen, you want to chime in about the kinds of services that you offer?
Sure. I'm trying to start my video here. So I'll talk without video then. So good evening, everyone, and thank you so much for inviting us to participate. Substance abuse crises both can stand out on their own, as well as be immersed in other kinds of crises, and be a contributing factor. And so I really appreciate what Dr. Wong was saying about the emergency department. The most common kinds of substance use problems, crises that appear on their own tend to be a drug overdose. And we have seen drug overdoses skyrocketing in the last 4 months during the pandemic, even here in Evanston. And then acute intoxication from alcohol, which also I agree with Dr. Wong happens across the lifespan. And certainly college students in Evanston contribute to that for sure. But we do a lot of work with people, I would say both immediately post-crisis and then as they're trying to work their path forward. And so since that's the topic tonight, I wanted to say that, we have been serving the community in Evanston for 45 years, and we do a lot of crisis phone work. People may get into a crisis related to their substance abuse because they were in the hospital, or because they've gotten arrested, or because people in their family are saying, like, we can't take it anymore, right? And one of the dynamics of substance use disorder is that people's denial about what's happening is part of the problem, and it's actually what's happening in their brain. And it's not to say that people don't make choices, but that is that denial is really very loud for them. And so, I think that's why sometimes getting arrested for a DUI or some other intervention at work or school, can be helpful to people to understand what's needed. I think what we would like to be able to do is effectively serve people in crisis, but also reach out to people when the crisis hasn't quite peaked yet, right? When there's awareness that there's a problem, maybe in the family or in the community, but it hasn't escalated to the point where the police need to be involved. And Betty and Kristen and other people talked about the importance of that. That is is something that's really quite compelling to us. About half of our clients come to us because they're required to by someone else, and we are happy to work with them. But it's painful to know that there are a lot of people suffering that we aren't reaching. And one example I'll give is this year with, since schools shut down in March, that a lot of that early identification work that gets done in schools, whether it's about substance abuse or mental illness or child abuse, is not happening. We don't know how those kids are doing. Some of those kids and their parents have reached out to us, but we have really noticed that just the kind of the quiet zone there right now, and are trying to figure out, if school doesn't happen in person again, how we get ahead of that this fall. So all that is to say that there are a lot of different sort of, I guess, situations that people find themselves in crisis. And I think that my top recommendation, as you all are rethinking like how to balance out crisis intervention and crisis management in Evanston, is that we need the good work that's done in the immediate, but there also needs to be a really sustained follow-up of some kind, and whether that's done by nonprofits or whether that's done by the city, what we find is that people will find themselves in a crisis, and there is a real moment often for people in crisis where they are willing to consider their situation differently and maybe take some steps they haven't taken before. But then they go back into their life, right? And so then all these forces are kind of competing against each other. And that's true even if a person has a home and a job and food on the table, right? Let alone if they have the other kinds of crises of homelessness and poverty that some of our other colleagues have been talking about. We have had a pilot project last year with St. Francis Hospital where we did in-reach into the emergency department. And we had a small grant from the Evanston Community Foundation that allowed us to do this project. And we learned a lot together about that and about what people were willing to accept. And that is that we know that moment in the emergency department is really just a moment, and so the ability to follow people over time, I think, is what will create some of the outcomes that we're looking for really across the board. And I want to echo what my colleagues have said about the strong partnerships in Evanston between the city and the human service agencies, incredibly valuable to us as well. We rely on each other all the time. And if there was a way for us to consolidate and coordinate that work, whether it's through like the Alameda model that Dr. Wong talked about, or some other form of kind of integration across systems, I feel like then you'd have more of a receiving net for people, regardless of what the different factors are in their crisis, and less of this kind of fragmentation, like kind of who belongs where.
Okay. So, thank you. Alderman Fisk, yeah.
Yeah, thanks. I guess I'd like to hear a little bit about the role that the Evanston Police Department plays in this and your relationship with them, and how you think we might improve that, if improvement is the right word, but how we might make that a better relationship.
Mm-hmm. So that's a really interesting question. First of all, I'll say that we occasionally need to rely on the police in our facility, and we're very grateful for their professionalism and willing to help us. Because every once in a while, as Betty said, things escalate, beyond what we can manage. And we're very appreciative of that. It's interesting when I think of most of the time when we've had interaction with the police around a substance use crisis, it's been a drug overdose in the community. And we've appreciated the rapid response. And then, we don't really see the police after that because they're involved in getting the person to the hospital, or maybe with fire and ambulance, getting them to the hospital. And then we will probably not encounter the criminal justice system again until maybe the person, either if they were driving, it was a driving under the influence arrest, or the person comes back to us because they're on probation. And so we actually don't interact with the police a whole lot other than those two instances that I mentioned.
Okay. Well, thank you. So we have one more person, I think, in our room here to hear from Kristen Kennard from the Moran Center. If you're...
Can you hear me?
Yes.
Okay. Okay. Good evening, everyone. Thank you, first of all, for having us. I'm going to start my video. Thank you for including us in this conversation. I'm really happy to be here and hear from all of our community organizations, which I know, we partner with majority of these people on a daily basis, pretty much. So I want to start with kind of talking through, like many of the agencies here, the Moran Center. I'm the deputy director and the director of social work services at the Moran Center. And we don't respond to emergencies and crises at a wider level, like throughout all residents in Evanston, but with our participants in our program. And so there's a couple different ways that we do that. The first is somewhat of a preemptive and prevention in regards to a lot of our clients have mental health issues, substance use issues, have experienced severe trauma. And so those who have severe mental health issues that can oftentimes result in psychotic episodes or substance use induced psychotic episodes and whatnot, we try to work with those individuals and their families, if it's a minor, with their guardian. But if it's an adult, while they are in a stable position, to fill out the premise alert through Evanston Police Department. And what that does is if somebody does end up calling the police or calling 911 on this individual, their name and their address and a slight description of what might be going on, say that they're diagnosed with paranoid schizophrenia, or so that the police have some type of background when they're showing up. And so one, the appropriate and more well-trained officers can respond, but also ambulance, as well as if it is somebody that has family members around, that person will also be listed so that they can be there as an advocate. But the social workers at the Moran Center can also be listed on those. And Evanston Police Department and or Fire Department will often reach out to our social workers then if they do get a call. Or the family member will reach out to us, and we also try to, if we are able to, arrive on scene to help with that, to make sure that that person, if possible, is brought to an emergency room rather than being arrested because people don't necessarily know what's going on and they're not able to verbalize that. So we try to get those in place where it's appropriate beforehand, so that we can navigate that system and hopefully avoid an arrest in a criminal justice system involvement or mental health issues. The other way that which is primarily what we do, is all of our clients have a relationship with a social worker at our office. We have 3 social workers on our team. 2 of us are licensed clinical social workers, and our other one is master's level social worker working towards her licensure. And so we have relationships with, and all of our legal clients have access to the social work team. And so we, from the very beginning, when we start working with our clients, safety plan around crisis and emergencies and what to do if something, were to happen, whether or not they are able to respond to that and they are capable of recognizing those things happening, or if somebody in their family is able to, but working through, because most of our clients don't have the best and most trusting relationship with police officers. And so we are trying to find, safety plan ahead of time. And if something comes up, what can you do and where can you go? So we as social workers respond to a lot of crises where families won't call the police, but they'll call us as their social worker. And we have the advantage of having a pre-existing relationship with these people and their families. And so that helps us to be able to assess, one, knowing what we know about the family and about the individual, but also in de-escalation and anything else we might need to do based on whatever the situation might be. And so we get calls, our social work teams, we each have our individual clients, they'll call their individual social worker if there's some type of mental health emergency, if things are escalating in the home, if there's a domestic issue, substance use issue, I mean, you name it. We've probably heard it in those calls. And so what we do when we get those calls, we assess the situation and figure out, one, is it something that we can, a lot of times we can navigate it on the phone and we're able to de-escalate, talk them down, say, I can be there in an hour, we can go for a walk, whatever that might be. There's obviously some situations that we cannot, but at that point, then we already have some information. And if we need to call the police because there is imminent danger, then we're able to make those calls and give that information. I've worked there for 11 years and have only had to call the police. I can count it on my one hand. And so that pre-existing relationship really helps with that. And we also respond in person. If we're at the office in Evanston, around, we will go to the family home. We will go to wherever it is that this might be happening once we assess the situation and can respond in person as well. And so that's for all of our existing clients who are in. We have multiple different programs. We obviously have our criminal representation, so the individuals who have had contact with the police. But we also have our education advocacy program. We have our school-based civil legal clinic. And so that applies to all of those programs. Another thing that is good for you all to know, and props to EPD with this, is there are a lot of officers that we know, and officers that know certain clients that work with us. And so if they encounter somebody on the street or they get a call and there's something going on and they know that we're involved, certain officers, they'll reach out to us and say, hey, we know that they'll respond to you. Can you come? What's going on? And I'm able to go. Hopefully it's still on the street, but if they're at, the police department, go in and de-escalate things and try to calm them down. And clients usually respond better to that too, as well as if clients interact with the police or they get the police called on them, usually the first phone call. So it's, this is what's going on, and trying to calm them down on the phone so that they, one, react better to the police, because we know if, people show up and everybody's escalated, it's most likely, more difficult to calm things down. And so even just being on the phone with them sometimes when they're interacting with police officers, it is helpful to kind of keep the situation or to get the situation de-escalated. So those are the main ways that we really work with crisis and emergency response, again, within our clients. But I'd also, in thinking through all of this, I appreciate all the time everyone's putting into all of this, because we do have so many resources within Evanston. But I've listened to the last couple meetings and whatnot, and there's a couple things. I think obviously we're not the experts in this area. There are a ton of models out there. There are a lot of different things that can be done. But in my experience at the Moran Center and working with the population that we work with and whatnot, I would just really encourage people to think about, because I hear this thrown out there a lot, to really think through pairing a mental health professional and or an EMS with police officers on a call, because I think we have to think through that a little bit more, because that still doesn't necessarily garner the trust that some of the community needs and is looking for if you're still having an armed individual show up to something that may not it may not be necessary for. And it also can then seem like the mental health professional is just an extension or an arm of law enforcement, which it can also make it more difficult for a mental health professional then in that capacity to do their job in trying to de-escalate. So I think we have to think through that. And the other thing that I've heard a lot of that I just like to push back on a little bit or encourage you guys to think about is there are a lot, as many people have said, there are a ton of mental health professionals that absolutely it's not their job, it's not what they've been trained to do, to go out on the front line and respond to crises or situations that could escalate 100%. But there are also many mental health professionals that have gone into the field to do just that and to respond to those situations. And those individuals, I think, have a unique ability to de-escalate and to work through situations so that the criminal justice system and whatnot does not have to be involved. So I think really thinking through, what that looks like and getting input from, mental health professionals that are out on the line and going into situations like that on a daily basis is really important. And I would say the last thing that I would say is I think it's important to think about, and this goes to a little bit, Alderman Fisk, what you were, I think, trying to get at in regards to like how do you assess, what does the assessment look like on the phone and things like that. And I think another thing to think about as we move forward and try to come up with a plan would be to think about what dispatch looks like. And when these calls are coming in, right now they all go through 911, but if we were, if we come up with an alternative solution, what those individuals are trained in and what it could look like if those individuals were mental health professionals or trained in a way that they could assess those situations and then figure out, is it an armed officer that I'm sending out there, or is it something else that we're able to come up with from the very beginning? And again, I think whether it's social workers, counselors, whatever that looks like, that mental health professional has that unique ability to do assessments. And as we've heard from a lot of people over the phone, that can happen. So just another thing that I would encourage everyone to think about.
Yeah, great, thank you. Mm-hmm. Any questions from my colleagues? Okay, well, we really appreciate all the wonderful input that we've heard from all of you and just the amazing work that you all are doing day by day out in our community for us and for our residents who are experiencing crises. It's really impressive to know what kind of resources we have, and it's our job to try to rethink how we might put some of all of this together. Alderman Fisk.
Yeah, so I guess what I'm coming away with is that we need a quarterback and we need money. It sounds like we've got the resources, the personnel that's out there is just incredible. I mean, incredible. I think this is the best human services meeting we've ever had. At least I've learned a lot. So thank you all for being there. It's a complicated situation. Obviously, we have to deal with it, and like everything else, this is at the core of what our community is, providing these services to folks in need. So if anyone wants to volunteer to be the quarterback, that's great. But that's our job to figure that out, again, as a committee. I think this has just been incredibly helpful. Probably this conversation is overdue. And so we look at this as, as the glass half full, because now we're dealing with the issues that we probably should have been talking about for a long time. So again, thank you very much. It's been really helpful to me, and I appreciate it.
Right. Yeah. Well, Kristen, oh yes, Alderman Fleming, go ahead.
Go ahead.
Well, I was just going to segue into sort of a last item for us to talk about, but if you want to.
No, because mine are kind of bigger thoughts. So finish. I thought that was the last presentation. So
yeah, no, it is. What I was going to pick up on was Kristen's mention of the dispatch person who's going to help, direct the right resources to the right person or to the right. Anyway, the right people. So I was going to have a segue to thinking of taking another look at that compilation of 911 calls that we received from the police department a couple of weeks ago, and to see what kind of questions and further analyses we might want. But Alderman Fleming, I'd be happy to hear what you have to say first.
So I have some, I guess, more holistic thoughts. Judy, I think that we are all the quarterback. I don't think we have one person, unfortunately, who's going to take the round. I definitely know what you mean, because we need to kind of put this all into some working. So yes, for the dispatch piece, I do think that that's important to maybe have just a memo or something to talk about the training that our dispatch does have. Because if you have someone who's calling and screaming on the phone, there's a lot that goes into trying to assess what the person needs. Particularly like Kristen mentioned, if people aren't able to maybe vocalize what that is based on whatever state they're in. So I definitely would like that, maybe at the next meeting. I don't think I need a presentation, but maybe just a memo about the training the dispatch has. Another thing that again, for the next meeting, I had spent some time kind of speaking in the community or asking around in the community about Amita, who we had last week. Amita talked about the services they provide at the hospital and the library. And I have to say, I knew there was a social worker at the library. I don't think I knew the hospital 24-hour thing. However, in asking some people, I think I have some concerns about just kind of what the service is. I think, at least the folks I asked, it does not sound like it's maybe well known or well used. So I would like Ike, if he can give us again maybe just a memo on the numbers. I did look at the contract from MITA, but I'm unsure how many people they're actually serving, what the extent of that service is. That was about $145,000 that we are providing, I think, for the 24-hour service and the library service. And so I'd be interested in looking at that as Alderman Fisk talked about, we need money, right? And so part of the defunding conversation is looking at the police budget and seeing how we can reallocate it. So I think, in my mind, that's kind of where the funding is coming from. But I would also be interested in looking at the Amita piece as it is, kind of in that wheelhouse of some kind of crisis service to make sure we're doing the best thing with that. The other question that I had, or thought, I guess, that I had is that coordination of care piece that Maureen spoke about. So definitely, Judy, you're right. We have so many different services in the town. It would be great to have more coordination of care. I think some of these agencies are more well known than others. Some of the services and how you access them are more well known than others. And while that's not our job as a council, I would love for maybe Sarah Flax to kind of think through when we're funding through CDBG and Mental Health Board, if we are funding, kind of thinking through that coordination of care and what's overlapping and where the gaps are, so we can make sure with the limited money that we're giving away or that we're putting into the community, that we're really meeting the needs of the community. And so we're really looking at where we might have some gaps that we can help fill, particularly as nonprofits are in this place where they're fighting over funding from state and federal sources. So that's not necessarily for this committee to look at this very moment, but I do think it's worth really thinking through how we use the limited funds we have to make sure they are getting exactly to the right agencies in that coordination of care model. Because so many people we do know cycle through 911 in the hospital and a variety of places without getting situated. And then Alderman Fish, you had a comment. Do you want to go or do you want me to finish? Okay. So if I think back again to the kind of this defunding or reallocation or whatever word people want to talk about it, I would like us to look at where the, sorry, I wrote some notes here. Look at where the police department, and I imagine they won't think this, but where they're overstaffed. So where do we have, I know we had that Hillard Hines report at some point and there was some changing of staffing, but where do we have, maybe more officers if the need is decreased? So if we think about, our PST officers, I think we all think that those are very valuable. They're out in the community. They're doing probably more of this work that we're talking about in terms of these, responses to neighbor disputes and all these things that maybe aren't really 911 or police, response calls. But there are a few different things, right? So we have our special forces. So we have our TAC and our NET department. So I'm interested to see, how much we're using those and utilizing those folks in the skilled area of which we have them. So I think one dug some things and one some other things, but I would love to kind of get some more numbers as to, are those really the needs of our community anymore? I imagine when those were developed, maybe we had a different need. I don't know, particularly with the legalization of marijuana, do we need an entire kind of unit focused more on drug things, or are those calls decreasing? I think that is a potential place for us to look if we're looking at reallocation of funding. I would like to know a little bit more, the same thing for the I think it's called TAC department or unit, special unit. Again, these are bigger and harder choices, but I think, we're in a deficit. We're going into a year, we're going to expect a deficit. We don't know what the numbers from COVID are going to be into the next year and how it's really going to impact our budget. But if we're looking at getting the right resources to people in the community, we're going to have to look at shifting some money around, and we don't have a whole lot of places to do that. And then lastly, I had some thoughts that I didn't, go ahead, Alderman Fisk, because okay. I had some thoughts that I think I didn't really get to articulate well last time, so I tried to write them down. So people, nationwide have been calling for defunding. Whether or not we answer that call in the way that people think we should, I think for me, it's important that we acknowledge, just the history of policing was as slave catchers. And while that is illegal now, we don't operate under that model. That is how we ended up with current day policing. So I think it's important to recognize that for a long time, probably our African American community has felt the brunt of our policing, and we see that now with all the kind of nationwide uproar. We see that in our numbers. We talk about who's talk about car stops and all those things. They're very heavy for African American communities. So I think we just need to acknowledge that policing as a whole. Thankfully, we haven't seen such aggressiveness that we've seen in different places, but it was really to control and punish African Americans. So as we think about those resources, I think that's a direct to us hearing and acknowledging what's happening in parts of our community. So while we're not at the point of abolition, which would be a total revamp and get rid of policing and all those things, we are talking about reallocation. So I think it's important that we really think about policing practices, and this piece that we're talking about now is not going to overhaul all of policing, and people have mixed reviews on if we even need to do that. So we still will have some policing. We still will need to be very diligent on our policing and who's policed and how they're policed and all those kind of things, particularly as we look at the rise in electronic surveillance and what that means for people. But this is one step we can take, and I'm thankful that we're starting these conversations and starting to get this place before the end of the year. But this is one step we can take to kind of change the impact. And as Kristen mentioned, folks are calling her and probably other people in the community we haven't heard from, who just aren't even comfortable calling the police for that initial interaction. And I think that's important that we hear that and we honor that as we're making these decisions. So, I would like, I don't know if we're going to do it now, what your thought is, Alderman Revvy, but for us to really think through how we're going to formulate something new. So, all of these agencies do really great work. I think they all have said they don't have the capacity at this point to become a 911 response. Some have even said, the Y said that is not what they do. I am, as I said earlier, not really comfortable kind of outsourcing our 911 response to other agencies. I think Kristen's points in terms of, kind of merging another agency or having an MOU with another agency to represent Evanston has a lot of dynamics that we probably don't know about from our seats. And the 911 response is really vital. And I'd hate for that and all of our good intentions to get lost because our 911 dispatch doesn't gel with,
right,
whatever things might happen that we don't know about in all of our good intentions. So I would really love, and I would propose for us to think through this kind of new 911 response to come out of our health department. So similar to our victim services, but actually, trained to do more than what victim services does. Our health department, I looked at the org charts from years past when it was, big and thriving and had lots more services. I think it has capacity with, the right staffing and management to have.
You mean putting the whole 911?
Well, I don't know. I mean, I think maybe we look at that, but I don't know in terms of the 911 dispatch. I mean, in terms of this response. So I looked at a model that I can share with you guys, and they had kind of a crisis response team. They worked in the 911. So a little bit like Cahoots, but they didn't work in a separate health department. They worked in a kind of city health department. So there was a manager who obviously was credentialed and licensed and all those things. And then they had a staff and they worked, in the health department. I don't know if they were actually at the police department or not, but they responded to 911 calls. So as Kristen mentioned, I think, we have to be really mindful as well, having the right staff, but then having them to be able to respond without the police. Because if we're talking about people who are in a variety of states of, mental and emotional health, physical abuse, and we don't know what their, history is per se, if our 911 dispatch is able to say, hey, we need a crisis intervention person here, that person can go on scene and assess. And if they decide, okay, we need a fireman, we need a paramedic, whatever they might need, they can call for that. But I think having the right staff to be able to respond out of the health and human services, because we are providing a service to our, in that model, to me makes a lot of sense versus kind of this outsourcing. And particularly as Maureen mentioned, we need kind of a continuum of care thought that all these agencies, we're going to need them to be there to kind of have us be able to refer and pass people off to. And we need them fully functioning for that, as opposed to maybe burdening them with another responsibility and kind of crafting something new. And then that way, I think we can also manage it as the city. It ties in well with 911. They work well with police and fire if necessary, and it's not a whole other thing. So those are my
your thoughts. Thank you. Fisk, you had your hand up.
So all that's fine. I mean, I hear that, and that makes a lot of sense. And I want to make sure, that we think this through carefully, because I think that, the 911, the initial responder, the one who makes the decision who is going to be called next, that person has to be incredibly well qualified. And it's easy to make a mistake. It's easy to be tired. It's easy to make the wrong call. And we don't want that. We want this to work well. And if it works within the, the health department, I think that's less of a concern to me than making sure that we have the qualified people. Our police department is already short-staffed, and that's, I think, what we've been told. And correct me if I have this wrong, but the place where we can, there's possibly some revenue to be had would be in reducing the number of police, so that we would eliminate some more police positions in order to free up some money to hire these other folks. So I'm assuming that we're going to be hearing from either the city manager or police chief or whatever about how the department would function with fewer officers, and from what areas, as you said, Alderman Fleming, they might come from. Just an assessment of what kind of policing we are expecting and providing. I've had a couple of meetings in my ward at the invitation of residents in some of my condo buildings. Have had interesting conversations about this. And I'm hoping that everyone in their wards is doing that as well. When I was speaking about money before, Alderman Fleming, I was speaking about that Alameda example, and that's not money that we're going to establish by cutting a few of these police officers. That is actually going out and trying to have conversations with other communities, and maybe Northern Illinois, maybe CMAP. I just don't know what the organization, the umbrella organization might be there, but that makes, in terms of providing service and unburdening, some of the service providers that we have now, that seems to me to be a long-term strategy to, address some of the needs that we have. Well, that's not exactly what we're doing now. That's a goal. And so the conversations going forward, I think we're having another 2 this month, Alderman Revvy, another one? And
we're just going to have one more, because next Monday there's so many staff who are going to be on vacation and furlough that we'll skip next Monday. So we have the meeting on August 31st.
Okay.
Then we meet again in September.
Okay. I guess
we have a couple of weeks to put together sort of an agenda to be able to talk about the kinds of things that we're laying out right now.
Right. Okay. So I guess one of the things I would like to know from the department is what sort of staffing, what's the minimum staffing that they think they can do to provide the service that basically we're going to tell them that the community wants to provide. So is the next thing to have our ward meetings or have a community meeting, or what is the next step that we can kind of draw all of this together?
So
Madam Chair?
Well, I guess I'll just throw in picking, because I know Alderman Fleming mentioned the Hillard Heights report, and the sixth recommendation in that report was to do a staffing study, because apparently we've not done one for about 20 years, and we are sort of carrying along this staffing pattern that we've gotten accustomed to over the years without kind of taking a step to rethink it and see is that really
Okay, so
what would be.
we with the department and with the city manager and with the committee, how do we do that?
Well, I guess the question is whether the department could do it itself, or is that something that I don't know what's involved. Hillard Hines indicated, I have to go back and read that, but it sounded as though one option is that the department does its own staffing survey. Another one would be you bring in somebody from outside, but and I don't know how long it would take.
Well, I'm not sure that, I mean, given the community response to this, I'm not sure that an internal staffing study on the part of the police department would be accepted. I mean, widely endorsed. So I guess I'd be open to hearing what other options there might be. But I do think that study is needed. I mean, that's clearly the next step, is that we need to know that, for example, we need to go to our residents and say, this is the direction that the next conversation is in, and we need to hear from you of what kind of police department you want to have, which I think has been what's going on. And I mean, my next ward meeting is for the general ward meeting is on September 1st, and that's something that we're going to talk about at that ward meeting. But I think that's the next piece to this.
Right. Well, I guess, I mean, that's a much bigger question, I think, than the discussion we've been having, which is focusing on sort of our emergency response system. So I guess I'm hopeful that we can keep going with the.
But if we're talking about taking money away from the police department, I mean,
right.
Reducing personnel, I want to hear from them. What does that mean? I mean, where are personnel going to be reduced? I mean, Alderman Fleming makes a perfectly reasonable argument that maybe if, we have the marijuana dispensary now, maybe we don't need as many officers in, drug enforcement as we had. I just don't know what the answer is, but I think we've had a conversation that at least we can take to the department and say, your PST officers and your department knows the city pretty well. And I was really impressed with the response that, our officers can identify some of the Moran Center clients on the street and are responding appropriately. I think that's a very good and positive sign. But I'm trying to get from here to where I think we want to be at the end of September and October when we start talking about budget, because I don't want to start either adding positions or cutting positions, or, I mean, all of that's going to inform what decision we make in the fall with the budget. And I don't feel that we've touched on that yet without knowing from the department, I mean, what we can do, and from Corporation Counsel on, what effect the union contract has. So I'm feeling I'm all on board to do something. I just don't know what the constrictions on us are going to be.
Right. Yeah. No, I don't feel like I have the answers.
So
there's a question somewhere here. Madam Chair, I'll leave you to.
Well, Alderman Fleming, did you ever?
Oh, that's okay. I think there's a gentleman with his hand up, but we need to.
Okay.
Yes, Madam Chair and members of the council, Christopher Voss, Assistant Communications Coordinator for the City of Evanston.
Okay.
I just wanted to reference the question regarding the training for dispatchers and what level of training they receive. Okay. Each of our 16 telecommunicators whose experience ranges between 4 years and 30 years on the job all attend a 40-hour training accredited by the state for dispatching and for the job of being a dispatcher and a 911 operator. That training also envelops crisis call taking, whether that's by talking to suicidal subjects in mental distress, and otherwise. And during that or during their time on the job, they continue to take educational classes that cover those call types. Each and every month, we contract through 2 companies that provide us that continuing education, as well as they do what's known as emergency medical dispatching, where they follow a scripted series of questions for medical related calls that may also include suicidal subjects or subjects in a mental health crisis situation. I hope that addresses some of your concerns in reference to the training that a telecommunicator receives. In addition, we don't employ call takers as separate from dispatchers. We employ telecommunicators. They do all facets of the job. It allows them to move from one facet of the job to the other facet of the job quickly. It allows for a quicker response to emergency situations, because the call taker can dispatch the call at the same time while the caller is on the line with them, which provides more fluent information dissemination to officers and firefighters. Thank you for your time.
Yeah, well, thank you.
Thank you.
Okay.
So Alderman, at this point about kind of our next steps, I think you're right. To have a staffing study done by the police is not going to be helpful in the community. However, I don't know in terms of having a staffing study that's done by a consultant. I don't know if that's helpful for us in terms of the time frame. We have to do an RFP and all those different things. So there's probably a way we can. I think you're right. Maybe if Chief thinks so, a staffing study that we can put on the agenda for later this year or next year is probably appropriate. I don't know how we just get that done. Time frame we're looking for October. I think you're right. We have to figure out where we maybe I don't say have too many staff, but have an inappropriate amount of staff. But that hopefully is a conversation. Go ahead.
Well, I was just going to say, I guess I'm a little bit uncomfortable. I think we can probably take some steps forward, but I do think that I don't want to be boxed in by the budget discussion. I just, this is too important an issue to be limited that we've got to accomplish all of this in the next 8 weeks. I want our police department to work the way that we want it to work, and I really do think that knowing where those cuts might come from or how things might be rearranged is all really important to our conversation. So I feel I that's not something that I feel confident that we can do without a study. Now, if it means we can't do a study, then I would say to the chief, why don't you do an internal study and let us know what you come up with? Even if the community, that wasn't the community's first choice, I do think we need something. We need to hear from our police department on, what level of service can they provide and how much creativity is there in rearranging responses and personnel to continue to provide the kind of police response that we believe we need in Evanston, and still reallocate. So I'm a little concerned about forging ahead without that piece of information. I would much prefer that we got that from someone who is independent and not from Evanston, who is looking at our department objectively. But if we don't have the time to do that, I think that we definitely need to hear from our department. I mean, hear from our chief. So I wouldn't feel comfortable going ahead without that.
Would you feel comfortable if we put together some kind of whatever this alternative emergency response system is going to look like?
Oh, yeah.
On a pilot, it could be a pilot that's only certain, few hours a day as opposed to 24 hours coverage initially, just because we won't have the funds to do the full-blown program. So we get that started, because even just figuring that out in the next couple of months is going to be a challenge. And then over time, we free up additional revenue as we do this restaffing.
You know what? I need to know what the restaffing is going. I just want to know where I don't think we're going to have enough money by reducing the size of our department to do the things that we want to do. I think we're going to have to think more broadly about where funding is going to be coming from. And I think we'll find that out a little bit further down the road when we decide exactly what we want to do. It was very helpful to hear about the 911 training. I'm glad to hear about that. 911 is available 24/7. And if there are highly trained people there 24/7, maybe 911 exists outside of the police department on its own. I just don't know. I don't know what is going to satisfy the defunders and the people who support reallocation. I don't know how much of that is going to be removing from the police department into, for example, Health and Human Services. I'm happy to have that conversation. I'd like to hear more about all of that, but I don't want to be cutting the police department at the risk that we're going to then have to turn around and we're not going to have the kind of police coverage that the community wants. And I think that's the challenge right now, is that we're already 7 members in the department. I'm again short. We've gotten along without those 7 members, and maybe that's fine. And how much more can we cut? I just want to know again what the numbers are, so that we're not surprised, and so that we don't end up in a conversation at council just sort of willy-nilly cutting police department members, because that doesn't seem to me to be the wise thing to do unless we know exactly what we're going to be achieving and what we're going to be gaining and losing. So I'm open to all of this, but I can't do it without all of the information there, whether it's information people want to hear or not. It's important information to have, and I don't want to rush it. If we can't get an outside consultant to come in and in a timely way, at least I want to know from the police department. I mean, they know what's expected in the community. How many people do they think, and in what departments and what units do they think need to can be trimmed, and that then we can decide whether we agree with that or not. It's not turning over the decision to them. It's just getting their opinion. And I think it doesn't make any sense not to do that. So, yes.
Yeah, this is Chief Cook.
Hi, Chief Cook.
Good. If I may say a few words.
I can't see you.
Well, it's set up where you can't see me.
Oh, okay.
The Zoom is set up like that, but you can hear me. Okay, I'll say it now. I can start. All right.
Great. Hi, Chief.
The Evanston Police Department is a full-service police department. We're not just driven by calls for service, what you may have been getting in terms of data from the 911 center. We got Metro, we got CTA, We got 25,000 students over at Northwestern. We got a 50,000 seat stadium. We got the second largest water plant in the state. We got 15 elementary schools. We got the largest high school in the state. It's a lot of things that we have to cover with the limited resources that we already have. Now, in my opinion, responsible budgeting should be defunding. I should not be encumbering funds in this department for things that don't create public value.
Right.
Meaning the public gets value from what we do. So I think you need to consider all of these other issues as these things I just mentioned, the schools, the water plant. We just moved 2 officers into the water plant to provide security there. There has never been a policeman stationed there in the history of the police department. Now we got security over there. The student campus always presents a level of volatility. The school system creates a level of volatility and unknown incidents that may draw resources. So, when you look at our budget, taking out the $11 million that go into funding the police pension, we left with very little money to operate the police department. Probably a little bit less than $2 million. That $20 million in salaries is for the number of officers we have, and we had an all-time low. The cops here don't remember when the Evanston Police Department was at 149 officers. I'm the only one here that does. And I know we can function to a level of proficiency, but when you start cutting and not taking into account where we are in America in terms of crime, the things that this city has to offer in terms of your people that come here to visit, when you look at what services the public have come to want in this town, they want service. Now, all of this defunding talk been going on, and people still calling us for services. And some of those services are some of the services that we're talking about defunding. Now, Evanston Police Department was one of the first police departments in the nation to have victim services in the police department and youth outreach. I come back, it's gone. That was historical stuff that Chief Logan did when he was the chief of police here. We had a long history of advocacy for domestic violence, death notifications, just about anything, mental health. And so now I think we need to look at how we can get those services back in collaboration with other people. I think if you look at zero-based budgeting, line item review, I think you may find a few dollars. I'm not sure. But, just saying that you're going to defund the police. We did what the Hilliard Heights report asked us to do. I've done that. We looked at span of control, and what that is how many officers can a supervisor effectively supervise. And that was off kilter because we had one position, I'll give you a couple of them, but we had the executive officer here that was a police commander. He had zero span of control. He worked for nobody but himself, and he did the things that the chief wanted. So Hilliard Heights said that was inefficient, which I thought so also. We had a police commander and the Office of Professional Standards with one sergeant. That's inefficiency. So we got rid of those positions through attrition. And one of those positions is in freeze right now in the police budget. Well, actually 2 of those commander positions. And that was recommendation to some extent from the Hilliard Heights report. But in the COVID world, we have shifted to a 12-hour shift pattern, which is it takes 4 pods to run patrol operation. You got be for days and nights. So we actually putting more officers on the street because we in a 12-hour, you can look this up, it's called a Pittman shift schedule. We're putting more officers on the street due to that, but I don't have a police commander over the drug unit. I don't have a police commander in OPS. So that means more work that I have to do, which is not a whine, but it's just a fact of life. I have to watch what these people do from a upper management level so nothing goes off kilter. So I think when you look at things outside of just regular calls for service that come in through that police desk and look at the services that are driven by the university, services that are driven by District 65, services that are driven by other internal governmental agencies in our own organization. The unknown, when it's like we just had these murdering crimes we just had, we had to put more resources in these neighborhoods to make people feel safe. Those are the type of things that people expect, and diminishing our manpower to a point where that's ineffective is going to do nothing but you're going to pay for it at time and a half.
So Chief, Chief, would you say that you're pretty much at bare bones now in terms of staffing, or how would you say that there's some more staffing that you could look at, or do you think that you're sort of at the minimum now?
Staffing levels should be based upon service delivery. If we have a legitimate service that we can provide to the public, we should have adequate staffing to do that. But if you diminish our staffing levels beyond what they are now, and I've been here a year and a half, Alderman, and when I came here, we had 160 police officers. Now we're down to 149. So service delivery is going to become a question. And when you look at overtime, which I hear overtime, I was able to cut overtime last year by $135,000 over the previous years. I could expect that to go back up to provide what the public needs if we have a drastic crime as a homicide or some of that nature. I have to make the public feel safe in their neighborhoods. I have to put extra officers out there. When we activate these task force to investigate these crimes, it costs money. Training costs money. I don't control the cost of all of this stuff. As you stated earlier, Alderman, the union contracts and so forth come into play into this. So I don't want to take up too much of your time, but I did want to point out that it's a lot of things that drive what we do, and it's a lot of things that the public expect from us.
Yeah, thanks, Chief. It's just really important that we hear from you, and because we do trust that you guys are out there. You pretty much know the community standard, at least what people are calling for and what we as aldermen call on you to do. So I appreciate your jumping in here and giving us some information that's helpful.
I think one idea behind, or one reason that we're contemplating this alternative emergency response model is to be able to relieve police officers from having to respond to a big number of the calls that don't really require a police officer. So that would, that we could be, that a mental health professional and a medical person can respond to. So then those calls for service are, taken off of your plate, as it were. So I don't know how you feel about that, Chief Cook.
I believe in having those services available. It's very important to have mental crisis workers It would relieve some stress off of the police department. We back and forth to 901 Maple, back and forth, taking people to the hospital, and they're out 3 or 4 days later because, as someone stated earlier, it's like a cycle, and there's nowhere to ship long-term help or to get the help that people need. Tinley Park been closed for 25 years. It's nobody wants to care for our homeless people or our mentally ill. It's just a cycle of recidivism that we have to keep addressing. So any help that we could get, I'm for that. But I think when you look at it in a sense of defunding, you really have to look at what we do totally and unexpected in this town, where we could be efficient in dealing with that also.
So,
Funding, yes.
thank you. So I appreciate your point, because part of this is, getting the right response to the citizen base. And so Chief is correct. We don't have, where I talked about that continuum of care that Maureen brought up, we don't necessarily have all the safety nets we need to have in town for a variety of reasons, mostly because of state funding. But again, I think, I respect what you're saying, Alderman Fisk. There is more information that can always be brought to a conversation. I guess my concern is, and it doesn't have to be 8 weeks necessarily, but my concern is, if we're moving in a direction to keep moving there, and if we kind of get too far down with the report and this and that, then we there's a chance we can always bring up other things that we want to look at before we start to make decisions. And so I think, Chief, you're right with the level of service expectation. But I think, as we're looking at all kind of budget deficits, we have to, part of our job is to communicate to citizens what the level of service can be. We probably get calls all the time from people who want the city to do a bazillion things that the city can't do or doesn't have the money to do, and we have to just be honest about that. So in my ward meetings, I've been having conversations about this. Part of what I've also challenged or been communicating in my ward is that we have a responsibility when we call the police, right? So if you're upset with your neighbor with the leaf blower, if you're calling 911 or non-emergency, you are making, you are setting up for potentially a negative experience between your neighbor and the police, not because the police is negative, but because the person is just doing what they think is good neighborly work. And then here comes a police officer, and they're usually mad at the police, and they start to think the police are harassing them when it's really, their neighbor next door who's called. So I think part of this whole conversation that we need to have in the community is, some community responsibility on when we're calling the police on people as well, because the police go out when they are called. And if we are calling them on things that aren't police matters, that are just annoyances or things that we don't want to deal with and know how to deal with, then that's a responsibility of our citizen base. And so if we give them an alternative to 911 where you can call, still 911, but you can get someone who is appropriately trained to deal with the homeless, and it's not our police officers who are just able to kind of move a person along because they don't have anywhere to send them or give them or resources to help them with. That's not a good situation for the homeless individual or for the police. So I do think that we have to I would like us to kind of keep pushing and think about where these gaps are and what we can do. I feel like there's some money in the police department. Chief disagrees. I'm not a police officer. I can just tell you from, what I've observed. I was at one of the homicides, unfortunately, and we had a lot of officers standing around. And I, again, not an officer. I'm sure some had work that they were doing, but lots were standing under a tree. So I think that if we have another option for people to call 911, I think if we are dispatching our officers, in more creative ways, I think that there's a way for us to make this happen. It probably does. You're right, Alderman Fisk. There's going to need to be money from somewhere else. And, there's going to be other things that we're going to be looking at in our budget that potentially we decide we don't need to do next year. Alderman Revvy, I think a pilot program would be amazing. My concern with that is, are we going to get the best people to fill these positions if they're concerned that it's only
6 months?
A pilot, right? So if we have a great clinician who would be excellent for this job, is that person going to come and take the job if they're concerned it's only for 6 months or 3 months or whatever? Now, in this climate where people are out of work, maybe that works for our benefit. Maybe there are tons of people out there to do that. But I would just be concerned about setting it up that way
Yeah, right. Well, maybe pilot's the wrong word, but maybe something that's, ideally, I think we'd want something 24 hours a day, but maybe initially we can only do it 6 or 8 hours a day, and maybe the 911 record could tell us which hours of the day
Right.
have the heaviest demand or something. So
That makes
we
sense.
start small and grow big, as
Right.
opposed to calling it a time limited pilot.
Right, and that makes sense because we can still get good people, but kind of place them accordingly. So I think we've made some referrals for the next 2 weeks. Alderman Fisk, I think you're right. We need to have community conversations in this environment. I don't know if we want to have a community town hall, but I think we each have ward meetings and constituents we can reach out to have the conversation. I think if we're being honest, some people are going to like it, some won't, and we have to, as elected leaders, make our decisions based on what we think is best for the citizens and for our city. I think I've had 3 ward meetings where we've discussed this at some point or another, and I've had some people who are, interested and supportive, and some who are not. And I've explained to them, like always, I'll make my decision based on the information I have and what I think is best. It's not going to please everybody, but that is the situation I have. But I do, and I don't know, I think we should hear from the city manager. I think my thought was to get it done during the budget season, because then we're ready to go in January. We know where the funds are coming from. The police union piece, I think, is definitely one. I have spoken to Corporation Council, but Chair, maybe they need to come to the next meeting. They were at the meeting that Alderman Sufferton and I had, and they provided a lot of information about the contract. But probably good to have them come to our next meeting just to give us an idea of what our contractual obligations are.
Okay.
But I think, Chief is right. We have, I'm sure the officers feel like they are close to or at capacity. And I think if I asked our custodians, they would tell you the same thing. And, I think we're running short staff kind of all over the city with our budget deficit. So it's not my goal to make people's job harder, but it is my goal to serve the citizens more effectively and efficiently. And hopefully citizens will understand that as they follow along with the budget, that there are going to be some services we probably are going to have to consider not offering next year just because of budgetary restrictions. I don't know what those are, and I'm not projecting, but I just know we have a deficit and we don't have a money tree. So,
right, yeah. So,
well, can I just say one other thing about the budget? And this is not, I don't disagree with you about 911. I'm more than happy to have that conversation. As I said, I'm more than happy to look at, where funding could come from. It was really helpful to hear from the chief, and the chief, if I'm hearing him correctly, they've made a decision on the community standard of policing to be provided, and they're pretty much at that in order to provide what they've been, what has been communicated to them is the community standard. That's where they're at right now. So cutting anybody else or taking funding away is only going to negatively impact that. So then our decision, and I agree with you, Alderman Fleming, our decision is that, do we want to change the community standard? And that's a conversation I think is better left to us to have in our individual ward meetings. I just don't think it's even possible to have a huge citywide meeting right now, but it's, we are elected representatives, and as you said, we'll do what is best for the city and our wards, and hopefully make the right decision. So I'm not against. I'm absolutely open to all of this. I'm just trying to figure out how we're going to pay for it, because it is very clear in my ward, that especially with the tax increase that a lot of people were just feeling when they received their tax bills, that we I believe services have been cut farther than they ever should have been. I know I can see the effect of that. I hear the complaints about it. It is very, very clear to me that we should be thinking in terms of restoring some of those services that we cut. I don't have any idea how we're going to do that unless we start finding new revenue streams. It's going to be a really complicated budget conversation. So that's why I keep pushing to find out, what is it that we actually really need and where's the money going to come from? Because if we want to maintain a certain level of service, and this is where we need the chief to tell us, and we cut more police officers, then what is that going to do to the response that we feel that we need? I think everyone, it seems, has made the decision that we're going to focus on the 911, and I think that's probably a good first step. I think there's other things I would like to see in the budget. I would like to see our youth and young adult services be strengthened. I think I would love to see anything that we can do that breaks the cycle of incarceration. That's really important to me. And those are all conversations that we'll have here at Human Services. So I'm not against anything. I'm here. But I can tell you that there is a level of policing in my ward, and I'm assuming in all of your wards, that people expect, and how we have that conversation with them. And I think Alderman Fleming, again, don't call about the leaf blowers. I mean, call 311 and ask staff to come out and enforce, some of these laws that we have on the books without calling, 911 or bothering the police about them. So I think, that's a city manager sort of exercise that I think is important to do here, but it's all part of the conversation. So, I feel I'm not being terribly helpful. I sound more confused than I am enlightening anything, but I really welcome the conversation, and that's what I'm saying. And I'm trying to work through it in a way that we end up with the best possible outcome. And maybe we're not all going to agree in the end. I'm usually on the losing end of most of those conversations, but the conversation is extremely important, and it's a real change of course for us in the city. We haven't had to do this before, and in some ways, it's really good. It's really good to have the conversation, but it's much more complicated, I think, than trying to shoehorn this into a budget season. So if we can sort of keep this focused on the 911 response, I think that's something that's doable by the time we get to budget season. Further than that, I think we need to look at where the money is.
So when you say the 911 response, you mean the 911 response?
The 911, yeah.
With some mental health professionals or some kinds of people.
Yeah.
Up the slack.
Yes, and
right. So how about
that's worth the conversation, and I think that's something that we can figure out whether we can do that in this budget conversation, or whether that or whether we can't.
To know, I mean, if we could kind of come up with a plan for what this would look like on a modest level to start with, an 8-hour a day, maybe even only 6 hours a day, I don't know. And what would it look like? How many people would it take to make it work? What would that cost? So we at least know what we're talking about when we start going into the budget season. We have that question, so we could try to work on that at our next meeting, along with having Corporation Counsel coming to talk to us about the contractual issues involved with, shrinking the police department, or should we just stay focused on the 911 piece?
If we're talking about shrinking the police department, I guess I need to go back to chief and find out where in the police department where we can shrink. I mean, if that's our revenue source is shrinking the police department, then that's one thing. If shrinking the police department to be able to say that we're shrinking the police department, I think we're already down, and I don't know. I mean, we're down, what, 7, 10, 13? I don't know how many people that we're down.
A good, let's say 11 officers, you mean?
Okay, I need to know what that is actually going to mean. If that is actually going to mean that
No, I agree. And I think part of what we also need to do besides planning our next human services agenda is setting up these meetings with our residents because we haven't had that conversation. I mean, I know Alderman Fleming has, but I haven't had a conversation yet with my ward about what they expect from the police department either. But so I see that as sort of a longer term discussion. Because I guess I'd really like to see if we couldn't come up with a plan, a proposal in time for the budget that deals with this emergency response system as one way of addressing having fewer officers.
Right. And one thing. Okay. Oh.
Alderman Fleming, we haven't heard.
Okay. I'm sorry. Can I just jump real quickly?
Sure.
If that's the goal, is having fewer officers, then we need to tell the chief that right now, so that we can find out from the chief how many fewer officers we can have. I mean, if that's the goal, is having fewer officers, but I'm not there yet. I don't know what having fewer officers actually means in terms of service.
The goal is providing the best outcome for our residents that we can, and for those who are suffering from mental illness and homelessness and substance abuse, the better outcome, I think, is going to be if it's with a mental health professional, a medic, or somebody like that. And then the result of all that is that then we don't need as many police officers because we've eliminated the need for them to respond to that many calls.
Okay, and on the surface of it, that makes perfect sense to me. I mean, I absolutely agree with that. But it may be that the department, and I'm not trying to stick up for the police department here. I just don't want to start making assumptions that aren't based on fact. So that's why I need to hear from the chief. I mean, if we're going to be focused on, providing the service, which is an essential, very good, positive, indisputable service, then how many officers can we cut in order to pay as much as possible to fund these services? Or is the answer to that, you're talking, apples to oranges here, that's just not the function of the various units won't accommodate that. That's what I need to know from the chief. I need to know that. And maybe we've talked enough about this tonight to give the chief some direction on that. If we have these, responders, how much does that relieve the police department of a need to respond, and how does that then translate into numbers of potential officers that are no longer required? I think that's the question.
Yeah, good question.
And Chief, you don't need to answer that tonight. I think that's the question that I've got. So I'm trying to work through this.
We can have that question at our next meeting.
Yeah.
One thing that I feel like we covered at the last, we had these reports about the number of officers, number of vacant spaces. So, I say there's 10, I can't remember. Some are held, some are frozen, some are vacant. That's a question also during the budget time. If we have 11 vacant positions, if we don't fill them, they were filled at some point. And so there was money to pay those 11 people who are no longer here. That money might also be a pot of money. That's a question probably for Kate.
That money's gone. We're not paying that. It's gone.
Well, if they're
other stuff.
Okay, so I'm going to suggest we move forward. I appreciate your concern, Alderman Fisk, and I think there are some questions for sure to be answered. We're not making a decision tonight, but I guess for me, and I think you're right about talking to your citizens. I'm ahead of the game and have done that. But we're all going to talk to citizens, and they're all going to have a different suggestion or concern or response with the police, right? Some people are going to feel like, yes, we have to have all the officers we have now. I need to be able to pick up the phone and call 911. And I don't think we're not, I was very clear with people in my ward that when you call 911, I want you to have a response. If you are being held by gunpoint, God forbid, I want you to have someone trained to come and do that. I don't want to send out a social worker for that. But if it is not that, and it is something else, then I want you to have the appropriate response for that. And I think so, you know, you are going to have a different response, obviously, than other folks. The people who, you know, I don't want to say are leading this conversation, and we're not working in response to necessarily one group. But I think, again, if we just think about policing, there are people in this town who feel over-policed. They're not going to tell you there are a limited number of police, you know, in their neighborhood. They're going to tell you they feel like there are too many police. There are people who are going to say that at the schools. There are some people at the schools who like, you know, having the 2 officers there. So we are going to get a mixed response and probably not a majority, and we have to make decisions that we think are best. So I'm all for surveying and talking to people, but at some point we have to, you know, make our decision based on what we think is best, the information we have. So Autumn Revvy, I like your idea of the not pilot, but kind of a beginning program. If we do 8 hours and, you know, however that, you know, we work with.
Let's at least see what that looks like. Yeah.
Yeah. To see if that, and I do think if we have someone who's trained to go out and work with someone who's having whatever issue they're having, if we don't have an officer who's going out. That doesn't mean that officer is not necessarily employed, but it means, you know, if we have 13 or 14 officers on the street now, maybe we need 11 because we have this 1 or 2 people who go out for these really specific calls, and we're not sending an officer out for that. I also think part of what we maybe are asking our police to tell us is, I think we have 14 officers on right now who are on the street at any moment. I think that was the number. But we have other officers who are employed who are not, you know, patrolling the street, so to speak, at that given time, which is why I talked about the special operations team, right? They're not necessarily, I don't think, I could be wrong, out driving in their cars all day like our patrol team are. So those are definitely valid questions, but I think this, you know, this place we're at with pushing forward with the 911 response is something that we need, whether we have 14 officers or 85 officers, because all those officers don't need to respond to these kind of calls we're speaking of. And then the thing with the leaf blower and all, yes, that's for us to help educate our residents to not call. I mean, my ward officer is great, but she will tell you that a lot of the things she's doing in my ward are these neighbor disputes that she's great at. And, you know, we're thankful for her, but it's not really the role of a police officer. You know, neighbors who can't agree on their fencing or someone's, you know, not picking up their dog poop. We don't need a police officer for that. We need individuals to pick up the phone and talk to each other, but we don't need an armed officer who is trained to do a lot of other things and not necessarily come out and, you know, deal with these disputes. So again, in my ward, we've talked about this. I've had a consultant come over who talked about communication skills and punitive and restorative justice communications with each other, so that they're not, you know, because I'm not skilled, or my job is not to come out either and deal with people's, you know, with their neighbors either. And I'm sure Eleanor Revvy, you probably get those calls as well. So, you know, we have to kind of train our residents to also talk to each other.
I think we're talking in circles now. So
yeah, right. No, it's
I believe we all been talking in circles. So I gave some referrals. Autumn Revvy, did you? I guess we have staff on here who's writing those down. Without seeing people, it's hard to tell who's the staff. But I made a couple referrals for our meeting.
Okay, of topics, I mean, of things we
Well,
want.
just memos that I would like to have.
Right. Yeah.
Hopefully staff got those, and then we're meeting on the 30th.
The 31st. The 31st. Yeah. So, well, that sounds good. Somebody like to make a motion to adjourn? Whoops, we lost Alderman Fisk.
So I make a motion that we adjourn.
No, I'm here.
You're here. You're there. Okay.
Okay. Second.
Yeah. So, and
there's Nicola.
Yeah, I think we don't need to do a roll call for this. So consider us adjourned, and I welcome your input for specifics for putting together the agenda for the 31st, because we're all in this, struggling with this together here. So thank you all, and thank you so much to all the people who attended our meeting this evening to give us such great information. It was really, really, really helpful. So good night, everybody.